Hello students, OGGuru Dr. Punit Bhojani here, presenting you the exam day strategy for the upcoming NEET PG examination. So lots of students, there's panic and nervousness among students. Sir, how do we approach the exam? So it's a very important video. Please stay right till the very end. Feel free to get in touch with me on phone and WhatsApp on this number for any further guidance. And I had conducted a 6-hour live classes. Recordings are available. OBGY rank booster course, just 249 rupees. If many of you are still struggling with OBGY, just give 4 hours. So many of students have been joining in the last few days. Just give 4 hours to OBGY. It's tremendously going to boost up your score. It's a completely MCQ based revision. More about this later on. And just if you give 4 hours to this course, it's going to tremendously boost up your score. Download the OGGuru app and let us move further. Okay, so now the first thing, how do I approach the NEET PG paper? So first, the basic things you should understand that first, initially it was a 200 mark paper. Now it is a 180 MCQ paper, 180 MCQ, not marks, 180 MCQ. There are going to be 5 sections. Consider each section as one individual examination, like how in test cricket, session by session. Here you will do the same thing. You will do one session or one section at a time. So every section is one exam of 36 questions and you have to attempt 5 mini tests. 36 into 5 is 180. So 5 sections totally are there for you to attempt, and each you are going to get 36 MCQs. You cannot come back. Remember this, once the timer is over, after the section is complete, you cannot come back. Even if the question is marked for review, it will disappear once the section is automatically completed. Okay, so time is of essence. That also I'm going to discuss what you are going to do. Every section is 42 minutes long. So your strategy should be not for the entire 3.5 hours. Focus on just the 42 minutes and not the 210 minutes. Is it clear to all of you? So as I said, break down every section, and 5 sections or like 5 mini tests. Consider it that you are going to give 5 mini tests of 36 MCQs. This should be your target. When you break down it into smaller target, it becomes easier. So one big paper, 180 MCQs, 210 minutes. Yes, but better start thinking that there are 5 mini tests of 36 questions, which I have to finish each in 42 minutes time. Okay, now the 42-minute strategy. What will you do in this 42 minutes? Okay, try to go and give 3 passes. What do I mean by 3 passes is that you will go through the paper first time, second time, 3 times. Okay, so 3 passes. What is you will do in each? The first pass or the first attempt, 25 minutes. 0 to 25 minutes. Very simple, no logic. If you see the question and you know the answer, directly mark the answer with confidence and move on. Don't keep on thinking about it. Okay, here you need to have some confidence and move on. If you can eliminate 2 options, 50-50, you mark the answer. Now only 2 remain. 2 eliminate ho gaya. Mark the answer and you can mark it for review, of course, and again move on. Obviously, if you can eliminate only 1 option, definitely don't take a risk initially. Mark for review, move on. And if, of course, there's completely new MCQ, you have no idea, all 4 options are looking, never, you cannot eliminate, then of course you need to move on. So first you start on doing this and follow this and try to finish all the 36 MCQs in the first 25 minutes time. Is it clear to all of you? Question, answer, like that. Then the second pass which you will give from 26 to 40th minute, please understand all those who have marked for review, all the MCQs which you have marked for review, you are going to do in this second pass. Mark the best answer if you can eliminate 2 options. Okay, because please understand there is negative marking. You cannot sacrifice on accuracy just for to increase the number. So if you are eliminating 2 options, that at least you can answer and attack the remaining question if the time permits. Then you would want to think on it that I need to more think, and then if you're able to get the answer, please mark that. In the last 2 minutes, make sure you have attempted all the questions that you wanted to. So review ke liye koi bhi nahi rakhna, and then you are happy, and then you answer all which you are completely confident, and what you don't know, of course, will you, because there's negative marking. Is it clear? So I repeat, what you need to do, totally 3 passes in that 42-minute section. Make sure ke first wala hum, of course, I'll tell you how to read the question details, what mistakes students are making, that also I'm going to discuss there. So first pass, 25 minutes, first go through all the MCQs in the 25 minutes. and what you are confidently know, confidence, mark and move ahead. If two options you can eliminate, mark for review, mark the answer, mark for review. Okay, if you eliminate only one, or if you cannot, you have to mark that for review and move on. Okay, is it clear? Second time, all that is another 15 minutes. Okay, another 15 minutes. So second time you will start going through the section again. Only those which you have marked for reviews you will focus on. Don't think of what you have already answered confidently, because there's a human tendency, अरे वो वाला MCQ correct होगा तो शायद मैंने wrong mark किया है, all that. Okay, and the last 2 minutes is just to make sure that everything which you wanted to attempt, or whatever you wanted to attempt to, you have marked all the MCQs. Is it clear to all of you? Now, the 30-second rule, 30 or 35, 40-second rule, what is it? The mistake students make is they will calculate, okay, sir, 36 questions are there and I have 42 minutes. So I have 70 sections in 70 seconds per question. No, it does not mean that you will give 70 seconds for every question. Very, very important. Why? Because certain questions will be very long, certain will be short, certain MCQs you will have to read 2-3 times. Okay, image or a video or something, then you will have to see it again. Okay, so after 30 seconds, after 30 to 35 seconds, if you are not able to eliminate at least two options, move on. You're not getting the hang of the MCQ. What is this topic? You're not able to go on. You cannot keep on spending more than 60-70 seconds, because your starting may also your speed will be slower. Remember, in first section, as soon as you enter the first section, your speed is slightly slower, and then you will pick up pace, and second, third, fourth sections do well. And again, by the fifth section, thoda sa mental fatigue sets in, and by the fifth section, you are of course mentally drained. So you need to keep up the energy, physical and mental energy and alertness should be at the top and highest level. Okay, so after 30 seconds of a question, if you cannot eliminate at least two options, you need to move on. Okay, because don't get stuck by one question. Do not let one difficult question consume the time of three easy questions, because it's going to be a mixed paper. Obviously, all questions will not be very, very long, and all will not be difficult. Certain will be easy MCQs, certain will be mid MCQs, and of course certain will be tough MCQs. Is it clear to all of you? So do not panic. Now this can happen on purpose, that suddenly first 3-4 questions are tough. So that this is just purposefully done to put you off the track and off the guard. Starting like when how the ball is bouncy, and this you are very tentative, and you can leave some balls also. And then when the ball and the pitch becomes easy, then you start scoring the runs. Same thing can happen, that if in the beginning, in the row, if few questions in a row you are not able to answer, do not panic. Keep following this 30-second rule. Of course, the easier questions will definitely come after few. Okay, so keep on moving is the mantra. 30-second rule, 30 to 35 seconds. If you are not able to, do not give. Yes, overall you have got 70 seconds time, but then you also would want to, as I said, review and all that. So first 30 seconds, try to finish off all the MCQs. 30, 35, 40 seconds finish karo, so that in first 25 minutes, as I told you this, because in the first 25 minutes I want to finish all the 36 MCQs. Is this clear to all of you? So keep this 30-second rule in mind, and if the paper starting mein tough hai, it will improve, don't worry. And after 30 seconds you cannot eliminate even two options, you need to move on. Is it clear to all of you? Now, very, very common mistake when you come for review, do not change the answer without reason. So many students have told me, yes sir, first time what I had thought, I changed, last moment I changed many answers, and many of them were wrong. Okay, so do not change the answer without a definite reason. What are the reasons? That when you are reviewing, you will change your answer only in the following situations. That means you did not read the question correctly. First time, what do you mean did not read the question? That you noticed that the question was actually having something like except, you did not read, or not, which is not the correct option, or which of the following is incorrect, and you read it wrongly. So you have misread the question, and the last part of the question which was there, you had not read it correct, then yes, you can change your answer. Or some hardcore fact, which like something like a cancer staging and all that, which initially you had forgotten, now you are very sure, okay sir, this is the staging, or this is some numerical value, and you remember a fact which had initially forgotten at that time, then of course you change it. Or if there are some biostatistics, PSM, some calculation mistake you have done, then of course you change it. Is it clear? And you finally realize that the option originally you had marked is not fitting into the clinical finding, that some clinical finding is given to you, and sorry, this cannot fit for sure. So only in this situation, there's a very important slide, you do not change the answer without a reason. Only if in this, if your question you're not read correctly, or some calculation mistake, or some hard fact which you forgot, which now you are remembering, then you change your answer, or if you, as you related, your original option mark completely contradicts the clinical finding which you is given to you in the question. Now this, my dear student, majority students make a mistake in reading the question. This is a very big mistake. You cannot do this, and your target should be completely eliminate. You need to eliminate. Now yes, it's a human nature. Eliminate this mistake. This reading mistake एक भी नहीं होना चाहिए. Every word in the question is important, and specifically when you come in the last line, slow down. Why slow down? Because the last line will tell you the main thing, that which of the, like how I'll give you the example. So slow down when you read the last line of the question, what the actual question, because starting may be a big clinical case, and I'm going to tell you about OBS also, what you need to give the last line of the question. You need to read correctly, whether they are asking you, is it all of the following are true except पूछा क्या, which is not the investigation, which is not the next clinical, which of the following is false, okay, is that which is incorrect, like this, which of the following is most likely, next step, first investigation. Okay, so every time you know this, the best investigation, first investigation, is it clear? Next step, like that, most common, okay, and least likely. So these are the important things which you will look in the last line of the question. Okay, what is the actual question asking you? Is it asking you all of the following are true except, or which is not true, false, correct, or which is the most common, least common? Specifically the first investigation you will do, or the next step, or the best management, what will you do for this patient? Like these questions are there. I'm sure you are prepared, so you need to keep this in mind. Now specifically, my dear students, for obstetrics, gynec and obstetrics, I always tell the students, for specifically for obs, please read everything, not only the age of the patient. Gestational age is very important. So many students, like is the case of first trimester bleeding and third trimester bleeding, management is completely different. I hope you know that. So please read how many weeks the patient is given to you. Is it 12 weeks, 16 weeks? Lots of things are time specific in obstetrics. You do certain tests at 12 weeks, certain things you do at 16, 18 weeks. How will you manage at 37 weeks? How will you manage at 34 weeks? Answer can be completely different. Okay, placenta previa, 34 weeks, answer can be different. 37 weeks, answer will be different. Okay, so look at the gestational age. Second, look at the maternal condition. How is the mother condition given to you? Stable, not stable, all that. And of course, do not forget the fetal condition also, whether there is a fetal heart rate given to you, whether there is fetal distress. Look at the fetal heart rate, all that you need to see, and then completely decide what you are going to do. So specifically, my dear student, in obstetrics, totally OBGY 20 questions are there, 10 in gynec, 10 in obs. Definitely out of the 10 MCQs in obstetrics, 4-5 questions you are going to face this kind of a clinical scenario, at least minimum. So look at everything. Look at the gestational age, what is given to you, maternal condition. So you need to read the question totally, read it in total, and just based on one parameter, do not decide what you are going to do. So read each and every word of the question, and please, reading error you try to eliminate, because that वो बहुत बुरा लगता है कि yes sir, I know the answer but I did not read the question at that time. So here you need to, how, when you are calm, when you are stress free, and when you are focused. Okay, so only when you are calm and focused will this error go. So it is a human nature to feel stressed and tentative, but you need to calm yourself, and you do not need to lose hope and focus. Is it clear? Now, how many questions to attempt? There's always a debate. I am not a fan of the theory that you attempt all the 200. But of course, if your target is to come in the topper, like when it was a 200 mark paper, you used to say, okay, mark 180, 190. Now it's 180, so 170. How many questions do I mark? But don't go with any fixed number in mind. Why? Because you will be wasting time in calculating. Array, first section I had marked 28. Second I have marked 30. Total how many done ho gaya? Third mein itna mark kiya, fourth mein itna mark kiya. So all that is going to add up to the confusion. So do not go with any fixed paper, like how every ball you have to face on merit, every MCQ. Just follow the 42-minute strategy, what I already told you, and you go through every question and judge every question on its merit. Like how in cricket, every ball you play on its merit, same thing you do, you will still score more than most of the students. That means every question you do, because please understand, there's no fixed rule. If the paper is very, very tough, even at a slightly lower correct questions, you will get a good rank. The paper is easy, then of course more answers you should have attempted. Okay. So do not sacrifice, as I said, the accuracy by increasing the number of attempts, because you there is negative marking and your marks will go in negative. And for questions you do not know anything or can eliminate only one option, it is better not to mark. It is a foolishness if you mark it. Okay, so the rough guidance is like if a student is targeting a mid rank, I think after 180, 150, 160 is a good thing. Of course, if you're hiring ranks than 170, you'll have to mark. Otherwise, anything between 150, 160 is a good attempt, depending on the mid score if you want to do. As I said, this obviously completely, it depends on your preparation on the day, and it also depends on how the paper is and how tricky the paper is. Okay, so don't go with any fixed number in mind is the advice which I would like to give you, because and don't keep on, definitely don't do this. Don't keep on adding and calculating how many attempted after each section. It is unnecessary, going to waste your time and increase your stress and pressure. That what is the common mistake that, sir, in the first, okay, in the first section, I marked only 20 out of 36. So now next, I have already left out 16 questions. Now I need to mark more. And in that you will go and keep on going in that error. Okay. So session by session, test by test, one session at a time you will do and focus on that set of 36 MCQs. Do not think aage, do not think piche. When the new session starts, you need to quickly reset, reboot. That is very important. When one session is over, you need to reset your device and reboot your device and stop thinking of what is already over. Okay, is it clear? Because you cannot go back and change anything. Okay, very important. Familiarize yourself with the NEETPG interface. Already a mock test is there on the NBA website. I have given all the instructions on my Insta also. Practice how will you move in between the questions, how will you mark for review and finish the section before the timer goes out. All this is available on my Instagram profile. I have put it. You can link and screenshots are there. Please go to it, and how each and everything is to be done. I have put a post regarding this. Please go through that. Is it clear to all of you? Now, there are certain general instructions which I would want to give all of you, which is, of course, reaching the exam center on time. Many students, there were some unexpected rains and traffic and all that. They reach the exam center late and all that. So please don't do that. Okay, make sure which is your center and reach the exam center on time so that you are not panicked. Now, before 15, 20, 30 minutes before the exam, do not discuss with your friends at the last moment. Okay, once you are inside, because after intro also is going to be time, keep to yourself, just keep on praying, stay absolutely positive, say a short prayer, keep on thinking, you can keep on thinking some song or something, or just to divert your attention and just stay absolutely focused. Yes, it is a human nature to feel nervous, anxiety, stress, tension. It is absolutely human. All of us have gone through the same thing before the tough exam. Okay, so you will feel pressure and tension and stress. That is nature, that is natural, absolute natural, but try to minimize it by staying focused and calm. Those who are calm will win the game. Is it clear to all of you? So reaching the exam center on time, knowing where your center is, getting up on time. That's why you need to adjust your sleep wake cycle. Many students are studying late in the night. Even I also have a habit of studying late in the night, yes, but now last 2-3 days adjust your cycle, because you will have to get up early. Many times if it's the gates open at 7:30 and by 8:30 it closes. Okay, so you'll have to reach get up early at 6:37 on the day and reach the exam center by 7:30. Of course, the timing instructions all are there given to you. So adjust your sleep cycle. Don't be remaining awake the previous day whole night. Start getting up and at least minimum 6 to 7 hours sleep. I know it will be difficult, but please try to have 6 to 7 hours of sleep before the exam. That is very important for your mental calmness. So these are general instructions which I said. Okay, and like keeping yourself hydrated, reaching the center on time, proper eating, all that you do, and then you are calm and focused and not stressed. And my dear students, this is my mantra which I am giving you for the next 3-4 days. Absolute power of positive thinking and power of imagination. What do I mean? Starting from today, I've said this many times before, I'm again repeating it. Starting from today, at least give 5 minutes every day. If not 5 minutes, at least 3 minutes every day. You will imagine what all good things are going to happen to you in the next 3 to 4 years. That means imagine yourself, you are entering the NEETPG hall with absolute confidence. Imagine, start thinking, think all good things which are going to happen. Think that your paper is going superb. Thak, all ball I'm going for 6, uda diya hai, ठक ठक, correct, whatever I have studied, that only question is coming. Sir ने ये image बोला था, same question is coming, this is coming. So imagine yourself that you are doing superb scoring well in the exam. Imagine yourself jumping with joy when you come out of the examination hall. Imagine that when you're going recall, all your questions are coming correct. And imagine yourself on the day of the results, you're jumping with joy, hugging your friends and parents and seeing your result. And imagine yourself already doing PG. Imagine that you have got a PG seat in your favorite branch, in dream branch and dream college. So all this, and imagine yourself as a consultant also, and 5 years down the line, how you are treating your patients. So this power of imagination and power of positive thinking, every day spend 5 minutes doing this and you will see the difference. Is this understood, my dear students? And this will happen with all of you. I can guarantee you, you can see this. Even the 4 hours rapid revision course, all questions from sir's notes and papers. Sir, OBGY absolutely cakewalk. Every question, sir, all 22 questions were from your video. Same thing, many questions directly from your videos. Even the question structured as it is, you can read this at your time. So my dear students, many of you, if you're struggling with OBGY now, also download the OGGuru app. Just give 4 hours. As you know, the single most important subject, whichever source OBGY studied from, don't worry, it's a completely MCQ based revision, question answers. We had 6 hours of live. You can see it at 1.5x speed. Just give 4 hours, 249 rupees. What is it going to cover? All the clinical MCQs in OBGY, all the IBQs and video based question, and the most expected question. There are these videos with the recent advances. Please just give 4-5 hours on the app, and still now also you can boost up your OBGY. And if with your current knowledge you are stuck up at 10, 11, 12 questions in OBGY, after this just 4 hours your score is going to jump up to 16, 17, 18 is my guarantee. 4-5 marks more, 4-5 more MCQ correct. I do not need to tell you the importance of these. So quickly, those who are still struggling with OBGY, there is time, and you can quickly download the OGGuru app and just give 4 hours on the app, and 240 rupees. It is the rank booster OBGY. This is only for OBGY, and your rank is going to boost up for sure. Okay, so please share this video with all your friends and colleagues. Here's wishing you absolutely banger of a performance. You will do absolutely well. क्रैक करके आना है, तोड़ फोड़ के आना है. Be relaxed, stress free. All of you will do very well. Share this with your friends and colleagues. Please follow on Insta and YouTube. This PDF I will upload on the Telegram channel so you can get from it. So go through this as I have told you. Follow each session at a time and stay calm and focused. And here's wishing you final best of luck. After the exam is over, please WhatsApp me. Please WhatsApp me the MCQ so that we can come out with a recall session and give you what was the best possible answers. Okay, so here's wishing you finally one more time best of luck. You will come out as the winner, and best of luck.